I generally see two types of patients for liposuction. The younger patient that has a little bit of fullness under the chin and a lack of definition on the jawline, and the middle-aged patient that also has some contour irregularities of the jaw and wants this treated at the time of their mini lift or neck lift. Through the use of the advanced techniques and refinements in liposuction surgery, we can provide our patients advanced healing and shorter recovery times, which they really appreciate.
I'm Rhonda Day. I learned about Dr. Gross actually through another plastic surgeon, through Dr. Purvell. Dr. Purvell has worked on several of my friends, and he's done tummy tucks and breast enhancements and all kinds of fabulous things. But I went to him and said, if you were wanting to have plastic surgery on your face, who would you go to? And he said, Dr. Gross. The other doctors that I talked to did not have the video imager, and so you saw before and after pictures, but what I wanted was very specific. And I wasn't getting a full facelift, I wasn't getting my eyes done, which looking back I probably should have, but all I was getting was my chin, and there weren't a lot of, I call them chinectomies, but Dr. Gross has the better term for it. But so in my case, seeing before and after pictures did me no good. And also seeing a before and after picture on somebody else's bone structure and somebody else's skin, to me wasn't all that worthwhile. I'd rather see it how it's going to look on my face.
When I first met Rhonda, she had gone through some weight loss and had a lot of need for removal of excess skin, fatty tissue underneath the chin, and she wanted refinement of her jawline. Basically, she had not seen her jawline for many, many years, and it was her.
Ever. I had never seen my jawline, by the way.
She wanted the jawline. So, I could tell from looking at her anatomy that she had a strong definition in her jawline. It just wasn't revealed because she still had a lot of excess skin, hanging muscle tissue, and some extra fatty tissue that, despite all her good weight loss, dietary control, and exercising, she just couldn't get rid of this. And you'll see when you take a look at her before and after pictures side by side how much we've accomplished for her. And it is an intrinsic reward to me to be here with you today and have you giving a testimonial to other patients so that they can see, what you've accomplished. And I really, really appreciate that.
Having gotten to know that you're a bit of a perfectionist and an artist and you don't want your artwork to be bad and ugly, it would give me great peace and calm that, okay, he's telling me that this is a step in the process and it's going to be okay, was very helpful. So I was very grateful.
I think there's a lot to be said for healing touch, and Rhonda can tell you when you're going through the process and you're healing, it helps to have your physician and the staff there to do some actual hand-holding and to help you through the emotional process of healing, because it is not just physical, as you know, it is emotional. And to have the staff and the physician available to you to physically handhold and guide you along the path of healing is very important. And I kind of pride myself in that. I feel a connection to all my patients because we have to feel that in plastic surgery. As the patient has to feel the same thing from their heart, that they're really connected and have a good bond and trust with that doctor.
Well, now when I look in the mirror, I don't look directly at my chin. I kind of even forget that I had it done, which is really nice. I don't focus on that anymore.
And Rhonda's also, referred several of her close friends and colleagues who've gone through the same weight loss procedure to us, and we've helped them as well. And it's been very, very rewarding, I think, from my perspective, but also from yours, to know you're referring your friends and patients to someone you really, really trust and that can handle and take care of the needs that they have, because there are some special needs with the patients, and we're able to accommodate that both, surgically and intraoperatively to tighten that muscle, because a lot of the patients do need muscle tightening surgery after significant weight loss, and that's what we specialize here.